everybody. I am Shelly Jo with Shelly Jo Hypnominos, and I'm with my friend here.
Dr. Seth from Activate Brain Clinic and Chiropractic.
It's been a long time.
It has been a while.
It's been a while.
Rusty.
We are a little rusty. We have not done this for a while, and because life has kind of been crazy the last 2 years, right?
Just a little.
Just slightly, huh? And so we came today. We're going to talk about a little bit of what we do since it's been so long. And what's going on?
Yeah, what's new?
What's new in functional med, functional
neurology?
There you go. And amino acids. Go ahead. You want to start?
Sure. Well, one thing that we've been doing more in our clinic now has been working with primitive reflexes.
I've never heard of that before.
So primitive reflexes are the reflexes that babies have when they're born, to teach them how to eat, how to learn how to roll over, also to help develop different parts of their brainstem. So like with a baby, we've all kind of done it, but you tip a baby down where they go like,
yeah.
Why? It's funny, we do it, but it's actually there to develop a different part of their brain. Okay.
Oh, you know that.
Another one that we do is you brush along the side of the cheek. You brush along a baby's cheek. What are they gonna do? They're gonna turn their head and they're gonna try to eat. Okay. So let's teach a baby how to eat, because the baby comes out, they don't know where they're finding food. Okay, so they have to have a reflex that kind of teaches them how to do it. But sometimes these reflexes don't stop. They're supposed to stop after like 3 to 6, sometimes 12 months. And if they continue, what they're doing is they're basically hijacking the brain. Because by that point, the brain should be developed enough in some regards to help inhibit different autonomic aspects of the nervous system. And if those reflexes just kind of jump right in, it doesn't allow the brain to inhibit stuff. So then we start to get overactivity in different parts of the brainstem. We start to get maybe different sides of the brain that now we're developing more than the other. So a lot of times you can see kids with like ADHD, autism, dyslexia, other types of learning types of difficulties that still have these reflexes. At the same time, you might also find the kid who has a bedwetting problem. They might still have one of these ones called the spinal galant, where you rub on the side of the back and they will flex to one side. Oh, wow. That's to help during birth, okay, to help get through the canal, but it's also there to help them learn how to roll over. But it has a lot of integration into the lower spine. So if we're having continual bedwetting issues, even with chiropractic or whatever else we may be doing, PT, acupuncture, massage, whatever it may be, and we're still having issues, that reflex could still be there. So we're starting to find a lot of these things that are going on, and something we've started to implement more into the office, because we found that we're kind of almost missing almost half of like the answer, because we would start about here and we'd see great results, but if some people still had these reflexes that we weren't really checking, then we didn't know why they maybe weren't getting as good of an improvement as we thought they could have gotten. And now that we've been running through this, we kind of start from the beginning, and now we get to the end, and now we're seeing huge improvements. There was a research article the other day that I found that talked about how people with traumatic brain injuries, so concussion or anything like that, have at least, there's like 95+% of patients will have at least one of those reflexes return.
Wow, so they could not have it for so long, and
then after a brain injury, it comes back. And then it was like 88% or more will probably have 2 or more of those reflexes come back. And we've seen a lot of it now because we work with a lot of auto accident patients, car crashes. We've been finding we've seen some huge improvements with just the neuro care. Like, we don't even adjust these patients because they're already seeing another chiropractor and he's doing a great job, or she are doing a great job. So we don't need to adjust them. We're just going to work the brain. And as we've been working through those reflexes and the other part of our neuro program, they've been making these huge jumps, even with pain and neck pain and headaches, but also on the cognitive side, like memory, brain fog, stress, anxiety, all these different types of things. So we've been doing some really cool new things just by implementing and looking more at a baseline level those primitive reflexes.
Wow, that's really cool. I've never heard of that, and I could see that being a problem, because you think that you're working one situation, and when those come back, I have a brand new grandbaby. She's 10 months old, and now I watch her, and everything is like right. And so we don't want that when you're trying to get better, right?
Exactly. Yeah.
That is cool.
Pretty darn cool. Pretty cool stuff.
Wow. I was just thinking, there's lots of chiros, and you have the functional neuro, right? What is, let's give them an idea. What is the difference?
So the one difference with it from the get-go is, we as functional neurologists, if we're board certified through American Chiropractic Neurology Board, you've done bare minimum 300 postdoctorate hours in neurology studies. On top of that, you take the diplomate exam, which is this big kind of like 8-hour test over like 2 days. So it's a written test and a physical examination test. And then on top of it, you have to do 60+ hours every 2 years of continuing ed on top of like your regular Cairo stuff. And also you have to write this bibliography about research that you've been looking at. So from the academic standpoint, that's one thing that differs us after like regular chiropractic studies. But then the other thing that's different is we use chiropractic as a modality. It's not our only thing.
Oh, okay.
So like chiropractic with the functional neurologist is just another tool in the tool belt. So we use a lot of eye movements to kind of gauge and see where people are at neurologically, because the eyes are a great window into the function of the brain. We use a lot of sensory stimulation, whether that's sound, vibration. We might use electricity, and we might do it on some different places, like maybe on the tongue. It's a great input right into that lower brain stem. We use a lot of vestibular stuff, so a lot of rotations, a lot of head movements, a lot of target tracking as we're moving. There's lots of different things that we can do, but chiropractic is just a tool in the tool belt. And so with that, we can then use a bunch of other things. We have a different idea about what we're looking at with the nervous system, that then we can also use chiropractic, but we can also use a lot of other modalities to try to affect change and balance out that system, balance out that nervous system, not just with a chiropractic adjustment.
Oh, I like that. We've been friends, what, like 4 years now? It's been about that long?
Probably.
Or 5 years. I don't know.
We
It's been a long
stopped
time.
counting. Bunch of friends, why you gotta count, right?
That's true. Except I was thinking, I mean, remember when I learned about you, and I had just learned about amino acids and how they worked with the neurotransmitters, right?
Mhm.
And I was like, I gotta meet somebody that understands the brain, right? And so when you and I first met, and you were telling me how, all this stuff about the brain and how it works, and yes, amino acids do help when somebody's had like a concussion or trauma. And it was so exciting to me. I was like, oh my gosh, it like opened my whole world up, remember?
Mhm.
And I went through your testing, remember? Because I have ADD. I'm sure you can't tell that, but I do just a little bit, right? And we sat down and you did those tests with me. And I remember you talking about my eyes and how they bounce all over the place, right? Which you wouldn't notice that if you didn't know what you're looking for, right?
Yep.
But you did say that it makes you more tired because your eyes get tired, right? And you're just going back and forth, right? And I remember when we first did that test, and I was way off. And then after like a month or so, it got to where I could actually follow the target.
Move where we needed to.
So cool. And I remember, like, back in the older days, not kidding, but 5 years ago, when somebody would walk in the room, I would divert my attention automatically. And then it got to where I could actually focus
On your task at hand.
on my task at hand. That is a cool thing. That was
Big
cool.
time.
Yeah.
Big
So we've learned a lot together. What have I learned in the last couple of years? Well, I've learned something really interesting. In the last 2 years, I learned that our brain doesn't know what to do with what's happened. Right? Would you say that?
Oh yeah.
It was interesting to me that, when everything happened a couple of years ago, and people would say, I just want to get back to normal. I just want to get back to normal, right? And here we are 2 years later, and we're still saying, I want to get back to normal. But the only thing that really is normal is that there is no normal. Would you say the same thing? Unfortunately, yes. And it was interesting because I went to Costa Rica in January, and I was speaking to the driver that was taking us all over. I'm like, how has this affected you guys? And his words were my words. It's like, I don't know how to do that, all the stuff that's kind of going on and everything. And then I have a friend that's in New Zealand, and her words are the same about not understanding what to do with all this information. And I thought, yes, we're going through this individually, but I didn't realize how globally it was till I started talking to people, right? The one thing that I did learn is that our brain likes patterns. And these last few years, there has been no patterns. So our brain doesn't know how to handle this, right?
Yeah. Repetition is the language of the brain.
So what do we do with all that? How do we get back to a new norm that somebody can start to live a life where they're not in fear, where they're not in panic, in anxiety, in worry, right? I used to say, when all this happened, and I thought to myself, if I could give everybody 5-HTP, which is for serotonin, right? Which is what helps you so you can think a little bit more clearly, weather the storm, right? It may not have stopped the things from happening, but it may have stopped everybody from buying a whole bunch of toilet paper.
Yeah.
Right?
Yeah.
It's like,
Definitely.
because it helps you weather the storm, right? When your serotonin drops, it puts you in anxiety, worry, stress, OCD, all those things, right? And so by raising it with 5-HTP, which is just one of the amino acids, it can help you weather the storm, right? Which can then help with those patterns that we can't find. Would you say, would you
Yeah.
agree?
Well, yeah, because if we don't have like, we're not feeling good, we don't have any like drive or motivation or anything, you're not going to then make patterns. You're not going to be like, well, maybe I should go and do this. Or I'm feeling good enough to go for a walk. You're not going to do it. And you're just going to sit down in your room, dark, away from everything, and just shelter. And you're definitely not going to make any patterns. And if you do make patterns, they're definitely going to be bad patterns. And you're just going to be on a downward spiral. And that's definitely not what we want patients.
No. I absolutely agree. So the way this looks is, like a 3-legged stool: brain, body, and emotions. So I work to feed those neurotransmitters, those happy, calm, feel good chemicals that are so wonderful, that give you your energy, your drive, your focus, helps you to calm down, and helps your brain to start to think a little bit differently, right? To get out of that panic or that worry that things aren't, it's kind of like Candy Penny, right? But the sky's falling, right? We got to get out of that. And we've been in it. And we have children who have seen a different world, right? We have teenagers. Can you imagine being a teenager at this time where teenagers are supposed to be where everything evolves around them and they're having fun, right? And yet they've been locked up in their house, isolated. And how do you get people out of that isolation, right? We got to change those patterns. Yeah. And so as a certified addiction recovery mental health coach, I'm going to go with the amino acids and nutrition, because there's a link between the brain and the body. Comes to mental health. What you eat matters, right?
Exactly. Big time.
And then as a certified hypnotherapist, we're going to work with the emotions.
Yes, big time. Big time. And that's why we love working with Shelly here, because I understand the emotions, but trust me, I don't work with the emotions like that. I'm working on getting the brain to function how it's supposed to function, get the mechanics to do what they're supposed to do. And if that helps overall with the emotions and the brain can process it on its own, awesome. If not, that's when we call Shelly and we're like, hey, we got a patient for you, and you got to help them take it to the next level, because the brain's doing what it needs to do. They just now need to be able to process those emotions. And then the brain's like, sweet, we're all good. Everything's happy. Let's go for it.
Awesome. That's why we work so good together. We got the brain chiro, we got the amino acid lady. And if you need any help, if you're like, I think I need a reboot, or I need something because my brain's been kind of on this, I don't want to say a hiatus, but
it's kind of like a roller coaster.
There you go, roller coaster. Then get hold of us. Go ahead.
So I'm, again, Dr. Seth. You can find me at activatebrainclinic.com. That's Activate Brain Clinic and Chiropractic.
I'm Shelly Joe with Shelly Joe Hypno Aminos, also known as Amino Acid Lady, and you can find me at hypnoaminos.com. In the meantime, guys, keep smiling. Mwah.